My name is Nyarai Gondo. I started at UWL back in 1999, when it was Thames Valley University then. I studied Higher Diploma in nursing. I came back and started my first degree then in enhancing clinical practice in 2008, completing that in 2012. So I work for London North West University Hospital. I'm an associate chief nurse. I look after the nursing, midwifery and allied healthcare professions strategy for the trust. And within that is about delivering recognition and ensuring that we've got a healthy workforce. And so I work collaboratively with our education team to making sure that we've got the right development package for staff. My background before I went into nursing training was marketing, so I had no knowledge of nursing. I remember from the onset when I came for my interview from Zimbabwe, the teachers were excellent, the lecturers I must say, really fantastic, very much supportive, and they were there throughout our study period of 3 years. Having discussions around career progression, how do you want to progress, where do you see yourself when you're qualifying was really important. So that guidance for us, I think most of us was crucial. I certainly valued my personal tutor when I was going through my studies because they shaped who I became, I think, today. The staff in the university, as big as it is, it never felt though that we were studying at a huge institution because you would come in, lecturers will know you by your name. I think having that sense that you belong to an institution that deeply cared about students' progress, students' career thinking, that was crucial. And I learned a lot. And I think having lecturers who had that mindset, who role modeled that compassionate about looking after their students, I took that away with me. I do that in our clinical areas where when our new students come into our environment, I remember that it really is important for a student to have a good experience while they're studying, because if we can make their student life as pleasant as possible and inspirational as possible, we know when they then qualify as nurses, they will become better nurses who are compassionate and caring. So yes. So my favorite part of the course was not just the academic side of things, but placements for me, because I had no previous hospital experience at all. So during the course, we were allowed to do many clinical placements. And I think doing that equipped me, for example, and I think in many other students about how that felt when you become a trained nurse. So yes, clinical placements were fantastic. And I really enjoyed them the most. I have managed to stay within healthcare. I've progressed from a student to a junior nurse, now to a very senior position within healthcare. Because those courses are set out, and if you choose the right course within nursing, absolutely you thrive. I have thrived all through all these years.